everyone. 3 years have passed since the outbreak of the COVID pandemic, and we seem to have forgotten about it. There is no longer the information about the deaths or about new cases in the media, and in fact, we seem to just have forgotten that pandemics or epidemics exist. But today, I'd like to talk to you about the fact that they might come back to us much sooner than we expect, and this is all due to climate change and to rising temperatures. So in my speech today, I'd like to talk to you about the climate change and how it affects our health. I believe it's important to talk about it because many people don't care about climate change unless it affects them personally and directly. So today I'd like to talk to you about how exactly, so what are the mechanisms of rising temperatures, of increased precipitation affecting our health. And I'll talk about 3 aspects. Firstly, I'll focus on heat and how heat affects our health and our organism's ability to deal with the diseases related to the cardiovascular system. And then I'll talk a little bit more about epidemiology, so about vector-borne diseases and waterborne diseases. And then I'll mention a few aspects that are also linked to our health and to climate change. And then I'll try to conclude what are the solutions, what can we do about it. So let me start with the heat and how heat affects our health. So what you can see here is the heat index guide. So it is an index that indicates how dangerous are the conditions for our health, and it includes not only the temperature but also the humidity. And with climate crisis, it is not only the temperatures that are rising, but also the precipitation is increased. So the 2 factors that are included in the heat index are considered here. This will result in an increase in this heat index in many places on Earth, hence increasing the possibility and the probability of people having heat strokes. In fact, it's already happening in many areas, also in Europe, that the temperatures and the humidity in the summertime is becoming unbearable for humans, and more humans are ending up in hospitals with very dangerous effects, sometimes and even more and more often leading to their death. And how, in fact, does the heat and the temperature affect our health and cause our death? So it is quite simple because it's all linked to proteins, which denaturate at temperatures around 40 degrees. So for instance, our brain, which is partially made of proteins, may denaturate simply, so it may simply cook at higher temperatures. And then our brain is not able to function, and this causes death. But there are also other mechanisms linked to that, because obviously death is like the worst case possible, but there are also other examples of how heat affects our health. And as I mentioned in the introduction of my speech, I also like to talk about the cardiovascular diseases and the diseases linked to kidney, because these are all the diseases that are linked to the levels and the imbalance in levels of water in our body. And in these diseases, such as heart failure, such as kidney failure, even a small imbalance in water levels in our organism may result in death or simply in very serious complications. So it's important to control the water levels in the human body in case of such diseases. But it won't be possible. It will become much more harder as the temperatures increase, and humans will lose more and more water from their organism, and the levels of water in their body will decrease, and this in many cases may lead to sudden death. So this means that with an increase in temperatures around the globe, we may observe diseases that were until recently well curable, and we didn't expect patients to die, that heat and due to water levels in our body. So what I wanted to show you here is, this is a pyramid showing how heat affects our health, and as you can see, the death is just a small part of this pyramid, but with an increase in temperatures, increase in humidity and precipitation, and generally the climate crisis will make this part much larger, and we will observe death and serious complications in patients suffering from heart failure, from kidney failure, but even in people who are perfectly healthy with an increase in temperatures. And this was the first aspect, this direct aspect of the effect of heat on our health. And another aspect I'd like to talk about is epidemiology. Firstly, I'll talk about vector-borne diseases, and I'll use malaria as an example. So as you can see on this map, malaria is today present mainly in Africa, and this is due to the temperatures that are in Africa, which are suitable for the development of both the malaria parasite and the mosquitoes that carry and transmit this parasite. But with an increase in temperatures, of course, the first thing that's going to happen is that malaria is going to transfer also to Europe, and we're going to observe more and more cases in Europe or in the United States, in the more developed parts of the world, where until recently we didn't observe many cases of malaria. But another thing that will change is also the rate of the development and the reproduction of both malaria parasite and the mosquito that carries it. So these are the two aspects that will affect and increase not only the change in the places where malaria will occur, but also the rate at which people are going to get infected with malaria parasite. And as you can see on these two graphs, when temperatures get really, really high, they're going to become finally unbearable for mosquitoes. So we may think that it's actually a good thing, because if temperatures increase, then at least in these African regions, the conditions will become unbearable for mosquitoes. But in fact, if they will become unbearable for mosquitoes, they will become also unbearable for us, for humans. So it's not a solution, and it's not a good thing, and in fact it's going to just cause more serious problems, especially in Europe. This is also linked to human migration, because if people from Africa are going to migrate from Africa to Europe, they're going to bring some of the diseases with them, and our health systems will face new issues related to epidemiology, not only the malaria parasite, but the malaria disease, but many others as well. And in case of the epidemics and the transmittable diseases, we may also look at the waterborne diseases. An example of this could be cholera, the cholera bacterium that causes cholera disease. And here the increased precipitation is the crucial factor. So I'm not sure if you were familiar with this, but in fact all of these bacteria have already adapted to cities and to developing in cities. So they're perfectly able to thrive in urban areas, and the only thing that's missing, or that they need to develop and to spread, is water. And climate change and increased precipitation is what is going to bring this water to cities, and what will allow for these bacteria to develop and to spread at a higher rate. So this is another aspect that's also important when it comes to epidemiology and climate change. I'm going to briefly mention two other aspects. The first one is the crop yields, which are obviously going to deteriorate as the temperatures rise, and this is one aspect, so the food shortages that will result from it, but also we may not be able to grow a wide variety of foods, and that way we won't be able to supply our body with essential nutrients, and more nutrition issues will arise from that. Another aspect that I've already mentioned, and it's important in the case of epidemics and epidemiology, are is human migration, but also when it comes to human migration, it's also worth considering our health systems and whether they will be able to treat as many humans as it's anticipated that will come to Europe. We've already observed during the COVID pandemic that our hospitals are not well prepared for such large numbers of patients that we've observed at the time. And if the number of people in Europe is going to increase, many more problems related to actually giving people this, granting people this right to healthcare we might not be able just to offer healthcare to as many individuals as will need it. And here I'd like to end this part, this more scientific medical part, and I'd like to briefly mention what are the solutions. Because in fact there aren't many, apart from just stopping climate change and trying to reduce the CO2 release in the atmosphere. There is not much we can do. There are things that we should care about right now, looking from the perspective of science, is to try to look for solutions to these diseases such as malaria or cholera or new viruses or bacteria that will be able to spread at much higher rates with an increase in temperatures. So this is an aspect that scientists should focus on. But also, here in Europe, we might consider changing the structure of our health system so that it will be able to treat more diseases related to epidemiology, more diseases related to heat, and that maybe we should educate people about the importance of water levels in the organism in the case of kidney or heart diseases. But in fact, apart from the preparations for the change that is going to come and the change that is already happening, there isn't much we can do. And I'm sorry to end with such a pessimistic note, and I didn't want to be pessimistic, but the reality is as it is, and I just wanted us to be aware of what we're facing, what will come to us, and maybe if any of you wishes to pursue a scientific career, you may consider and try to look for solutions for these issues. Thank you very much.